This is very exciting because we always say that chiropractic is an opportunity. You have opportunity when you come to a chiropractic office. Chiropractic care was developed before the turn of the century in 1900. And what chiropractic brought to the medical picture was that our bodies heal from the inside out, that our bodies are intelligent, they're smart, they can take care of themselves. And when they do take care of themselves, you have the potential to heal. When it comes to something as amazing as a new life and a mother carrying a new life, we want to give and express as much life as possible. That's what chiropractic's about, an expression of life, full expression of life. And we see that happens through the nervous system, So we're going to talk a lot about how chiropractic care and care for the pregnancy is synonymous with healthy, natural living. And that there are very limited things that moms can do when they're pregnant for pain, dysfunction, or to try to help the vitality of themselves. And chiropractic care can add so many opportunities, so many. So let's jump into this. Here's what I hope that we can discuss today. We get to this point. Number one, is it safe? I think number one thing that a lot of people are surprised or question is it really be safe to see a chiropractor when you're pregnant? Very much so. Will the adjustments hurt me or my baby? These are questions people definitely have. We're going to get into this. Can chiropractic help with back pain even when you're pregnant? And how about labor and delivery? I'll talk a little bit about what we call the Webster technique, and that's definitely for moms trying to make sure that we keep the pelvis in good alignment for removal of breech presentations. When should you start to see a chiropractor if you are pregnant? When during that pregnancy? So let's discuss a little bit about what happens during your pregnancy. Let's discuss that. Number one, relaxin. Relaxin is released during that pregnancy. That hormone starts to loosen your ligaments up. Your ligaments become loose, your pelvis needs to be preparing for birth. The pelvis needs to be able to stretch and extend, and so relaxin is released so that the ligaments become looser. At that same time, your center of gravity as a pregnant mother begins to move more forward. Your belly grows, obviously, and at this point, that puts extra stress on your spine, your hips, and your pelvis. So there's stress from hormones, there's stress from structural positions. What are some of the symptoms during pregnancy that people end up coming into our office or just experiencing even if they're not in our office? Remember, your body's doing incredible things right now. It's working overtime to keep up with so many things. So back pain and sciatica can be very real common problem. The baby himself can push on the nerves. The alignment of the pelvis is more stressed, as we talked about. Pressure in the pelvis, instability, round ligament pain, very common. Neck and upper back tension, as well as sleep being totally disrupted from discomfort and many other things. The spine and your nervous system, they need to connect. So your body and your brain must be in congruence. They must talk. Your nervous system controls every function of your body, including how your body supports and grows your baby. Your spine houses and protects that spinal cord. And this spinal cord is that main highway that your nervous system must run through. When your spine is out of alignment, your nervous system cannot communicate clearly. And that needs to happen in order for vitality and health. Is chiropractic care safe? Well, the short answer is yes. It's very safe. If I was a poor driver, I'd pay more for insurance, right? Chiropractors pay very little for malpractice insurance because we're very safe drivers. During pregnancy, chiropractic care is considered safe not just by chiropractors, but the American Pregnancy Association. Chiropractors trained in we all are trained in special prenatal care, use gentle, modified techniques if necessary for the pregnant women. And special positioning during pregnancy and having safe tables to use is one of the keys that most of our patients love. They love being able to lay face down because we have special pillows to hold the belly. Did you know that 80% of women are going to experience a low back pain at some point during their pregnancy? It's inevitable for many people because a lot of us have misalignments and dysfunction of our spine that we don't know about. Because our body isn't in pain doesn't mean there's not a problem. But when you have pregnancy, that starts to put more stress on an already stressed system, and that usually perpetuates what we see when it comes to back pain. In Switzerland, 115 pregnant women were followed with back pain, and they received chiropractic care over the course of the year. Over 50% of them reported improvements after just 1 week. That number climbed up to 70% after 1 month. By the end of the study, about 90% of these patients had relieved their pain and improved function. What about labor and delivery? Let's talk about the delivery. Would chiropractic Chiropractic helps to support the labor or the delivery of baby. The pelvic alignment plays a huge role in how well labor will progress. The pelvis should be balanced by the surrounding musculature and should be able to move freely. When baby has more room to get in, to the ideal position, your body can deliver more efficiently. So this is where chiropractic comes in. Better aligned pelvis, better mobility means safer and easier position for baby and for mother during delivery. In New Zealand, we looked at a pelvic floor muscle function in pregnant women before and after chiropractic adjustments. So they would test the pelvic floor and find out if there was stress or how well it functioned before adjustment as well as after. Before the adjustment was shown a lot of significant changes. After being adjusted by the women, they showed a greater pelvic floor muscle relaxation at rest, which is exactly what you need during labor. Your body needs to relax. There's data also about how long you could be in labor. One study reported that women who received chiropractic care during pregnancy experienced 25% reduction in the average labor time for first-time moms, which is huge, and 31% reduction in average labor for moms who had given birth before. Chiropractic care is continuing to support pregnancy on all levels, from labor to delivery, from pain to function. When every pregnancy and delivery is unique, these numbers definitely suggest that keeping your pelvis and spine aligned throughout pregnancy definitely would give your body a real advantage when it's time to deliver. What about prenatal visits? What do they look like? Well, they're gentle. They're very specific adjustments to the spine and the pelvis. There are specific techniques, and we'll go over the Webster technique that helps us to understand about the alignment of the pelvis, stresses in the round ligament, and how and where those manipulations need to happen to help release tension and help alignment. The Webster technique is that technique. The Webster technique is one of the most common approaches used in pregnancy for chiropractors. I am a certified Webster technique provider, and it supports optimal fetal positioning mainly through supporting the pelvic positioning and adjustments. We do not move babies. That's obstetricians. We help support the natural environment and alignment of the body, which helps the baby to get in the better position. And many moms with this technique have had very supportive labors, and their breech presentations even reverse. So when do you start chiropractic care? As soon as you can. If you need chiropractic care, start as soon as you can. The longer you wait to have an adjustment that is necessary, the more likely restrictions and fibrosis start to hold on to our bodies and prevent our bodies from properly aligning during adjustments. That first trimester would be definitely wise to get acquainted. If you know you're recently pregnant or even thinking about being pregnant, getting checked initially for problems before that pregnancy would be a really wise idea. By the second trimester, there's definitely going to be stress on your spine. So if you're waiting for problems, you might start to feel them here, but it would have been wise to try to prevent some of that stress beforehand. Into the third trimester, your pelvic alignment becomes especially important. And this at this point is when, if there's any breech presentations or significant stressors, we may be as very effective in trying to help versus a medical procedure. But know that if it's been that long of stress, it may be hard to remove all the problems in that short amount of time of that last trimester. But sooner the better. It's never too late though. Never too late to get checked, even a day before. The body's amazing. If we unlock some of the stress, you never know what will happen. So here's some tips that you want to use if you're pregnant right now. Definitely sleep with a pillow between your knees. The more that your knees are twisted or that you're twisted in your pelvis, the more that those ligaments are being stressed and strained and not lined up. Definitely want to stay moving. I mean, as tough as it is, as your baby is growing and your energy levels are low, you want to keep moving. Gentle walks, swimming, prenatal yoga, just trying to maintain muscular support. Strengthening is very important during pregnancy, but we don't want you bearing down. You don't want to be putting a lot of force, but strengthening is so huge. The stronger you are during pregnancy, the easier delivery and recovery. Mind your posture. Your posture affects everything. And if those muscles and stressors on your body are already extenuated because of your pregnancy, then poor posture is going to make it even worse. So mind your posture. Stay upright, stay mobile. We love the posture disc. The discs that sit on our chairs. You can find those on Amazon or in our office, and just sitting on those and moving side to side, front to back in circles, or a pregnancy, a big exercise ball. Those are great ideas to keep strong and flexible. Try not to stand on hard floors for too long. There's already more stress and weight on your feet. Your feet are becoming stressed, and that could definitely stress your pelvis. You might even look into some massage for prenatal. No matter if you're pregnant or not, if you're 90 years old or 9 days old, being being checked by a chiropractor is important. And if you don't know what you don't know, you could really get into trouble. So we always are suggesting and recommending people get checked. You may never need adjusted, but get checked, right? Well, you guys have a good night. Simple and short one tonight, but very impactful. You guys have a good night. Bye-bye.